Hello everyone, my name is Councillor Bangra. I'm here from the Royal Borough of Windsor Maidenhead. I'm joined by my colleague Councillor Stuart Carroll, who's the lead member for health. And I'm joined by Sajid Khan from the Maidenhead Mosque and a number of guests on today. So I think Stuart, you will to start off with a briefing on the COVID vaccine. Over to you, thank you.
Thank you very much, Gurpreet, and good afternoon, everyone. Thank you for making the time. I'd just like to, in the first instance, say a huge thank you to Sajid Khan for this invitation and for facilitating this opportunity today. I've always really enjoyed interacting with the Islamic community, and coming to the mosque, you always make me feel extremely welcome. And it's great to have the opportunity to at least see many of you today virtually. Of course, the world we're living in at the moment is rather difficult with the pandemic, but I hope everyone is keeping safe and well, and your friends and family as well. What I would just like to do in the first instance, just spend a few minutes talking about the COVID vaccines themselves. One of the really vital things for all of us to do is to take up that vaccine if eligible and when contacted by the National Health Service. Ultimately, the only way we're going to get through and indeed out of this pandemic is through vaccination. So let me just talk about the two vaccines that are currently being rolled out across the NHS. The two approved vaccines, so that's the Pfizer vaccine and the AstraZeneca Oxford vaccine. I'll start with the Pfizer vaccine. So the Pfizer vaccine is what we call a RNA vaccine. Effectively, what that vaccine does is it equips the immune system with the weapon, the tool, to know that when coronavirus makes contact with the body or is ingested into the body, that the immune system has the understanding and the memory to form antibodies to effectively fight that virus back. And one of the things with coronavirus, which is particularly problematical, is one of these spike proteins, which is on the surface of the virus itself. And what the RNA vaccine does is it effectively allows the immune system to use the protein to break down the coronavirus and therefore render the person immune, and the virus is then shedded from the body. The AstraZeneca Oxford vaccine is what we call a viral vector vaccine. It's similar mode in terms of how it works. Again, giving the immune system the opportunity to develop a memory, a response, develop antibodies, and then should the coronavirus vaccine make surface or contact with the body, again, the immune system is then in a position to break down that virus, shed the virus, and ensure that coronavirus can't then develop into what we call COVID-19 with all of its consequences. Both of these vaccines, I really do want to stress and emphasize, are extremely safe. They've been through a very rigorous and robust assessment by the government's independent regulator. You've probably heard this acronym flying around the media, the MHRA. That stands for the Medicines Healthcare Product Regulatory Agency, a bit of a mouthful, so that's why we call it the MHRA. And I think the important thing to say there is the MHRA, I can genuinely say this as someone who's been working in this area for about 20 years, is seen as world class. You know, it's top of the league. So it's the Manchester City, Manchester, Liverpool of the league, depending on what point you look at the league table and your footballing preference. But they are first class. And I think the important thing to just note for assurance is they, as I say, independent of government, so they can't have any political interference. These decisions aren't made by Boris Johnson or politicians. They're based on science, they're based on data, they're based on a very rigorous assessment of the safety, the efficacy, the quality of the vaccines. Also with safety, just to note that even when the vaccines are then administered, there's what we call surveillance monitoring. So the MHRA doesn't just approve something and say, job done, see you later, we're packing up, we'll leave it to the NHS to get on with it. The MHRA with Public Health England do constant follow-up, constant surveillance to make sure that those vaccines are not having side effects, adverse events on the people to which they've been administered. Now, as of yesterday, we had over 10 million vaccines administered. And we haven't had any what we call red flags, bad signals around the vaccines in terms of their safety. And the other thing I would just note, I want to give people assurance on, is that before any vaccine is allowed to go into the NHS system, there is a process called testing and batch release. And this is where, again, a body within the MHRA that's responsible will test every individual vaccine, every batch, to make sure that it's at the right level of sterility and potency, so again, that it's safe for human consumption. These vaccines are very, very efficacious, very effective. The data would show that we're talking in the high 80s, if not 90% range. So that's very, very high levels of protection. But of course, it's just worth noting that if you have had your vaccine or you go to get your vaccine, which is absolutely vital, it's imperative people do still stick to the guidance even after being vaccinated, because not 100% of people will get absolute protection or complete protection. And so you could still be at risk. And also at this point, we're still learning more about the impact of the vaccines in terms of what we call transmission. So if you're immunized, you might be protected, but can you still pass the virus on to other people? The good news there is the early data is suggesting that transmission is curtailed from the vaccines, but it's early days. We have to be cautious with that interpretation, and we have to keep following up the science and the data. So I'm just going to pause there. I just want to give that initial overview of the vaccines themselves. What I will just say before I pass over to Sajid to facilitate questions, it's worth noting that the Muslim Council of Britain has published statements around the COVID vaccines relying on the highly reputable British Islamic Medical Association, who I've had dealings with firsthand, who are first class, I have to say, and made it very, very clear, and you can access the information on the website, that there is a clear recommendation that people get vaccinated and that these vaccines are safe, effective and high quality. And I'd just like to thank the Muslim Council of Britain for their leadership on this issue, because actually, you know, across the board, even before this pandemic, they've been absolutely fantastic in terms of coming forward on issues of vaccination, and they deserve a lot of credit for that. Anyhow, I'll pass over to Sajid to facilitate some questions, and ask me anything you want. I will try my best to answer.
Thanks, Stuart. I would like to open it up to the people on this call. Anybody who's got any questions? I've got a few questions that have been passed on to me. If there's anybody who would want to, would like to answer a question, please go ahead. I'll tell you what, I'll start off then with the first question. The first question I've received, just to let everybody know, what I did was I just sent a general email to everybody, and if there's any general questions around the vaccine to ask, and I'll put it forward on their behalf. One person has come to me and said they've heard that the vaccine contains animal content or human fetus material. Is there any truth in this, Stuart?
There's a simple answer to that, no. Okay. No, there isn't any truth. And if you actually go to the NHS sources, I'd also strongly recommend, they've done a fantastic Q&A on the Muslim Council of Britain website. And it says here, for example, I'll just read you direct. So they've got a statement on the Pfizer COVID vaccine. One of the questions here is, does the vaccine contain any animal ingredients? There are no animal products in this vaccine, no animal-derived cells were used. I can confirm that is the case as well, and no human cells in the vaccine. And then for the Oxford AstraZeneca, same question is put here. There are no animal products in the vaccines at all. So the answer to that is no. The one thing to note, as it says here, does the vaccine contain human embryo cells? The answer to that is put as no. But the recombinant protein that is made in, that is used in the vaccine does come from cells descended from human embryonic cells, but the original and descended cells are not present in the vaccine at all. And the Muslim Council of Britain has made previous statements on that in relation to other vaccines, and has always approved the use of those vaccines.
Sure, thank you for that. Do you think it's worth me just going through the questions I have on the list first, which I've received, And then if any of them haven't been answered, I guess we can go put forward and somebody else can answer those as well.
Absolutely.
Okay. Second question I've received is, does the vaccine alter one's DNA in any way at all?
No, these are important questions, and I'm really pleased people are asking these questions. And one thing I just want to say, the answer to that is no, 100% no. So let's just be clear on that. But what I do want to say is it's important people do ask questions. If you've got concerns or you've got questions, this is right. You know, ask the questions. I don't want anybody, you know, thinking in silence, being embarrassed. The key thing is to get your information from credible sources, independent sources. 100% no, it cannot. It's immunologically impossible for that to happen.
Sure, thank you. The third question I've received is, a few people have actually asked similar questions, so I've grouped them together. It said, the question was, we're suffering from, the number of people are suffering from depression, high blood pressure, diabetes, and are on medication for these issues. And they wanted to know if the vaccine will have any negative impacts on their health in any way as part of it. Is there any sort of any problems with having the vaccine and taking these other medications?
Yeah, so that's a really important point. There are potential, what we call in medical terms, contraindications. That's a fancy word for basically saying that if you're on some form of medication or you have some underlying health condition, potentially when the immune system's being triggered, it could have an adverse effect on you. The best thing to do in those cases is to speak with your healthcare professional, your GP, in each instance to cross-check what is contraindicated and what isn't, because it does become quite an individual consideration. And there is what we call a risk-benefit calculation that should be made between what could be a mild side effect versus obviously something more severe. In the vast majority of cases, the evidence shows so far that the vaccine is safe for people who have underlying clinical conditions. But I think it's important in that instance that people do discuss that with their GP, with their healthcare professionals. So there's an individual discussion on that as well.
Sure, thanks, Stuart. The fourth question was on the two vaccinations available for COVID. Is there any particular one which is more favourable to a particular community, or is it just whichever one gets offered to you by your GP or any health professionals?
There's not one that is more favourable than another. Whichever one is available at that time, absolutely you should get. You can't actually really compare the Pfizer vaccine with the AZ Oxford vaccine and vice versa, because they actually had different, what we call different clinical trial endpoints. So it would be a bit like trying to compare a football team to a cricket team. They're not quite the same. And to that extent, you can't really judge one over the other. What we do know is they both have very high safety, very high efficacy, and all the real world evidence so far from the 10 million plus doses administered is that they have a very strong impact on stopping someone getting coronavirus, but also being hospitalized. So I think the message is whichever one is available, you're going to be getting a really high quality vaccine. It's therefore imperative to go and get it.
Thanks, sir.
Sajid, I have a question, if you don't mind me asking.
Please do. Please do.
Samia. Stuart, I'm purely asking in a personal capacity because I can't join this call in my professional capacity. So a lot of women from the community have asked this question to me, and I think it would be useful that if you answer this, so this can get recorded and people can get a surety. So mostly I've been approached by quite a few worried mums. Their younger daughters are either working as a carer or a frontline worker, and of course they've been offered a vaccination. And there's a lot of misinformation in the community that this vaccine might impact their fertility issues in future, or if young girls have it now, there might be some sort of gynecological kind of like impact on their health and all the like female development sort of thing. So I think it might be worth kind of touching that to answer that, and so people can get. I'm sure Sajid might have also had something similar.
Yeah, absolutely.
That's the one I'm constantly answering because I worked in the locality before, so they know me. So I've been reassuring, but I think in this portal I'm just joining as a resident, so I think it'd be good if we can get that looked at too.
Excellent. That's actually a great question, Stuart, because there has been a video been going viral in our community on that, and that's the reason why there's a lot of concern around it, especially with the sisters in the sisters areas itself, and in fact everybody really. So yeah, appreciate if you can give us some feedback on that.
Yeah, absolutely. So you know, this is a really important consideration, and I can understand the concern. There is no evidence to suggest at this point that the COVID vaccine has any impact on fertility. The clinical trials themselves didn't specifically look at that issue, but just because they didn't look at that issue, that doesn't mean we should jump to the conclusion that there is a problem or there is an issue. There are follow-up studies taking place to specifically look into that in order to try to satisfy public assurance even more, which is quite right. But the independent committee, which again, another acronym that you've probably heard, JCVI, which is the Joint Committee on Vaccination Immunisation, another mouthful, so hence JCVI, their updated advice, particularly following authorisation of the Oxford AstraZeneca COVID-19 vaccine, said that pregnant women you know, should be considered for vaccination if they are at high risk of exposure to COVID-19 or at risk of serious complications. And also they've noted at this point that there's no emerging evidence to suggest an impact on fertility. Again, I think what we have to do with these things is constantly follow the science, constantly follow the data, but there's no evidence at this point to suggest harm or impact. So I think some of these things that are circulating are simply not true. Well, they are, they're just made up. And I think we have to, you know, make sure that that information doesn't affect people's decision making. Again, if there is a concern, I would encourage an individual to always speak with a healthcare professional. You know, that's important. If you've got some specific concern because of your medical history or because of, as we touched upon earlier, medication you're on, or something that's genetic or something that's hereditary in your family history, then it's important to have that individual discussion, because then the best decision can be made.
Okay. Thanks, sir. Okay, another question which I have received is it was a question around, is there any known death rates around anybody who's taken the vaccination? Has there been any negative kind of impacts on people taking them? Because we've seen some videos where people have sort of fainted after taking the vaccine, and the gentleman asking the question wanted to explore if there was any figures around fatalities in any way around people taking the vaccination.
As I made reference to earlier, the MHRA does continue surveillance and monitoring, and at this point there's been no red flags in terms of people having the vaccine and the vaccine causing death. Unfortunately, what we do have to remember is that some of the people who have been vaccinated in those older cohorts may, and in some cases have already, sadly, even having been vaccinated, had already contracted coronavirus and therefore COVID-19, or had underlying conditions which led to mortality. But there's no evidence to link the vaccine to death or mortality at all.
Okay, thanks, Stuart. In fact, my last question, which I had received, was around fertility, which has been answered already. So that's really my question. Nadeem, did you want to ask a question?
Yeah, with respect, I think he actually answered the question with fertility. I think from the outset, the trial didn't run with any pregnant people at that time, and the recommendation was that pregnant people not to take the vaccine, as well as children, as well as people with severe allergies as well. So they were excluded groups, and the fact was that they didn't have any information as to whether the vaccine will affect them or don't affect them. So they weren't part of the initial trial. So what they're trying to do or do now, as the councillor was saying, is that some people are given those and they'll be watched for them. So they're going to be observed at the moment. So the information isn't there. So you can't either say either way, whether it will affect them or not affect them. I think the correct position should be that we're waiting to see, you know, what effects it will be, because we're now trying it on certain pregnant people.
I might, do you want me to kind of elaborate on a little bit on that, what Nadim. So there's two aspects of it. So, for example, initially you're very right, because people who had severe allergies, especially those had anaphylactic reaction, usually those have yellow EpiPen, and they were basically excluded from the list regardless of which age cohort going on. Then obviously there were further investigation completed, and the instruction which was given to personnel was that if you are allergic to any of the ingredient in the vaccine, so you can very easily download the information about the vaccine ingredients. So if you are, for example, if somebody who had a penicillin allergy and they had an allergy with some sort of antibiotics, they probably would have the similar reaction to if the ingredient matches with the vaccine. That's like with any other vaccination, not just COVID. It's like with any other vaccination. And there's detailed information available from NHS about pregnancy and women, pregnant women. There's a lot of information available. I can send the link to you, Sajid, so it might be good to circulate. And Stuart, I was just thinking it might have been really helpful for all of us attending this call that if we had clinical presence, and if we had been approached in a clinical capacity to kind of answer these questions more efficiently with all the data, all the figures we have, or some of the GPs from East Berkshire, CCG, Windsor, or Maidenhead, that would have been another way to kind of answer questions more efficiently. Maybe there's you guys can have a future session with a couple of GPs. Those are multilingual if you need it, kind of thing, through your CCG, and then get them, because all the questions that you're getting, these are all very clinical oriented questions, sort of thing. And I'm very mindful in terms of which capacity I'm answering these today, or asking these today, sort of thing. But what I'm really keen to understand, and all of you, please help me to, because obviously, Sajid, communities, you are a gateway to the community. The mosque, everybody comes to the mosque, they, contact you for funerals and all that sort of thing. Apart from these questions, what are the reservations within the Pakistani community to not take the vaccine? Is it because we are close-knitted community and one words of mouth spreads, people just buying that rumor and they're sticking to, or is it, the trust on the system, or is it the information hasn't reached to them properly, sort of thing? So that would be very, helpful to understand the other barriers or the caveats, in the system, which basically putting a restriction. And obviously, you guys are, been very, very, efficient in terms of, sending the information to people, whether social distancing, whether, different tiers, because as a resident in RBWM, I get that regularly from our mosque, because guys now, bring your own mats, and that time when we didn't have the national lockdown. So the instruction goes out to community, and community really relies on the information that coming from our faith leaders and community leaders like yourself and Ilyas Bhai and other individuals on the call. So apart from these questions, what are the other things that you guys have personally noticed, that if you try to convince somebody that you guys take your dad, granddad, uncle, for vaccination, what are their reservations? Why they don't want it?
I mean, if I may, Sajid, just before you answer that, because I think the point that was raised earlier is really important, and I can send you the link here just on the pregnancy and the fertility issue. As I said before, in the case of someone who's high risk or deemed high risk or have severe complications, the JCVI has said in those circumstances, following a discussion with your GP, people would be eligible for vaccination, because obviously there could be a live risk of, sadly, death from coronavirus itself. But the other thing that might be useful to share is that all the evidence from the non-clinical studies for the Pfizer vaccine and the AZ Oxford vaccine, which have been reviewed to date, have raised no concerns on safety around pregnancy. So that's the evidence we have so far, but it's right. We've got to look at more evidence, look at more data, so that can become a definitive conclusion, a definitive position, but that's what we know so far.
Thanks, Stuart. Yeah, sorry, you asked an excellent question around that. So to be honest, we as a community have been affected by COVID hugely. Over the last 2 months, we've had around 17 deaths in burials in RBWM. And and a few families in the area have had a couple of deaths, about 4 deaths in one particular family. It's been a really sad occasion for the last few months or so. Certainly the second wave itself. So we are really upfront itself. And from a mosque We're very grateful for the mosque team itself, who've been working very hard to keep the mosque open as long as we can in a very safe way. We've had stringent processes and procedures in place to make sure our staff were safe, the people attending the mosque were safe. So from that perspective, we're very pleased, and the community are very supportive of what we've done for them. So from that side, good. But in terms of them taking up the vaccine, I know of a number of our elders have taken the vaccine. There were some mistrust kind of issues originally. There's some of these videos which you mentioned earlier around fertility, the virus not being real. People were raising those questions at the start. They have started to die away when they've seen these numbers of deaths which have taken place in the community. So I think generally the community are forward, looking forward to the opportunity to have the vaccination. And I know a few people who have been offered, they have taken it, and the others have been asking, when will our turn come? It's obviously on priority basis and age and different things of coming into consideration. So there are concerns, and I think people have seen the impact of COVID and the detrimental impact to the whole community. In fact, whether it's the Muslim community or general wider community, it's just been phenomenal. I've been to the cemetery a few times, and just talking to the contractor who does the digging, he's just been saying it's emotionally really, really draining. I know, looking at the TV programs, our NHS staff are all a lot of them are turning to tears. They just emotionally can't cope. So the situation is very drastic, and people realise that we have to do the right thing. And that right thing, obviously, we're on this call together to get an understanding on the virus, on the virus itself, and the impacts of it, and also, the new vaccines. What can it do for us? And obviously, Stuart's done a great job of giving us some good feedback and answering the questions we have raised around those. So, but yeah, so the answer is that we're not 100% sure, but the feel we get is that the community are eager to take the vaccine when it becomes available. Obviously, these sessions, or this particular session we're holding today, will certainly help. We're obviously planning to live stream it out on our social media channels. So when people do see the video, they'll obviously be able to get the information they need. And if there's any questions which don't get answered for them today, and obviously I'm still available to take those, and Stuart has kindly offered to be available to us to answer any further questions, and I'm sure we'll work together and to make sure we do the right thing for our community and our whole town itself.
Very well said, Sajid. I just note that there's a question coming on the chat, which I'm happy to answer. So the question is, will the vaccine remain optional? The answer to that is yes. The government hasn't suggested at this point any plans to introduce what would be called mandatory vaccination, which we do see in some other countries. I mean, personally, I'm not in favour of mandatory vaccination. I don't think that's the right way to proceed. I think it's quite right in a democracy that people have the choice, but I think what is critical is people understand not just their personal responsibility, but social responsibility, not just to protect themselves, but protect others. And it kind of comes on to that. So just as we don't know the long-term effects of the vaccine, also no evidence that it prevents transmission. And for healthy people with no underlying health conditions of risk of dying from COVID are minuscule. The question then is, why would you take the vaccine as the risk outweigh the benefit? So a couple of things to say to that, that there is actually now evidence to suggest that the vaccine, certainly the AZ Oxford vaccine, can prevent onward transmission. Results from a new study are suggesting that it could reduce transmission by up to around about 67%. And the underlying hypothesis has always been that these vaccines would, to some extent, prevent onward transmission, because the logic being that, like with other infectious diseases where we have a wealth of evidence, if you're immunised, the virus is shedded, you can't then spread it. So there is now that evidence emerging, and I think that's a strong reason in its own right to want to get vaccinated, to not just protect yourself, but protect your family, your friends, and other people around you. And just to point out, younger people, I mean, we sadly have had cases of young people who have died from coronavirus or been very severely ill with coronavirus. I actually know a couple of people myself with whom I work. One actually has been off all of this week with long COVID. They had coronavirus, COVID-19 last year, and they're now suffering with long COVID, and that person has no underlying health conditions, is 40 years of age, and sadly has long COVID. So I think we have to be careful with the assumption that in younger people this doesn't have an effect. The evidence has shown that it does, but we also now have increasing evidence say that the vaccines will stop onward transmission, and that would be a game changer, of course, in terms of the effectiveness of the vaccines. So that someone's just put in, so we have the flu.
So I guess the question is that you've got these symptoms, which is COVID. You're obviously not well. However, some people do get the flu at the same time, and when people do have the flu, sometimes it can be catastrophic, where people can lose their lives with the flu, and have huge underlying health issues. And it does knock you out completely when you do get it. Obviously it's quite serious. So, how is it different? The coronavirus to the flu? Is it just another brand of flu basically, which is causing this?
No, I think it's a lot more serious and severe than influenza. I mean, remember, we have to separate what sometimes people call flu, which is actually a common cold, or a virus, versus influenza. Actual influenza, can be deadly and does in fact sadly kill thousands of people every year and hospitalise many people every year, and that is very bad, and why I would always encourage people who are eligible to get their flu vaccination, but influenza vaccination. In the case of coronavirus, its modus operandi is that it really attacks the lungs, it attacks the respiratory system, and in really severe cases, even moderate cases, that effectively stops people from being able to breathe properly, and as we've seen, be able to breathe properly on their own, and sometimes therefore have to be mechanically ventilated. So the overall picture we've seen in terms of severity of complication and severity of outcome of COVID-19 is one of the worst in terms of the infectious diseases of recent times. But that's not to underestimate the impact of influenza, which we know has a big impact on people as well.
Thank you. Any other questions at all? Mohammed Ilyas, please.
Okay, thank you, Brother Sajid. Assalamu alaikum and peace with you all, and I hope you and your loved ones are well. Thank you, Stuart, for your introduction. I've got a question about natural defense. So whenever we've been having an infection, what our own immune system does is produce the antibodies to fight those infections. So there may be people in communities everywhere, they might feel, okay, if I've had COVID and I've come through it, and especially with this particular variant which we're having, which was more severe than the first one, so they might feel that I've got my own natural immunity. I've come through it, I'm well, I should have the antibodies to fight any other variant. Okay, so the question to Stuart is, how would you convince people who think that way and they think they have their own natural immunity, so that they possibly don't need to have the vaccine, and then at the same time they may be hearing in the news that there's other variants, and so for its vaccine may have to be changed, we may need another vaccine. So there's two questions there. First, about the natural defense, and as the virus is mutating, will we be needing to take a different vaccine later on, and that would need to be developed? So those are two questions for you, Stuart. Thank you.
Yeah, well, thank you very much, Mohammed, and great to see you. I think what I would say here is that it is true that people can develop natural immunity, and that has been the case with all infectious diseases. The issue with relying on natural immunity is that, of course, anybody who has any kind of issue with their immune system, and that could be very small, very minor, and actually someone who seems relatively healthy, the immune system may not trigger the optimal immune response. The other thing is that what a vaccine very cleverly does in this instance is it particularly targets through a mediated response within the immune system the exact bit of the virus that needs to be effectively attacked and broken down to stop it multiplying and propagating around the body and then causing the consequences of the disease. The other thing with what vaccines are very good at doing is they help to multiply the number of antibodies, so they significantly enhance the way in which the immune system can repel and push back a virus. And vaccines are also good at ensuring that the kind of quality of the memory of the immune system, as well as the duration of the memory of the immune system, is as robust and as optimal as it can be. So it's for all those reasons why it's in everyone's interests who is eligible to get vaccinated, because that is a way of ensuring that protection for yourself and others is optimized. In terms of the second bit of the question, again, the evidence is emerging on these new variants. The underlying hypothesis is that the vaccine should be effective against the new variants to some extent. Whether it would be to the same level of efficacy for the baseline variant is still to be determined, although the recent evidence would suggest that the vaccines will be highly effective. I think what's particularly reassuring in this direction is that one of the new vaccines, which is not yet approved, a vaccine by No.5, actually has reported very high efficacy from its clinical trial. And in that clinical trial, they included some of the new variants, and the vaccine was, based on that clinical trial data, effective against those variants. So that is a positive benchmark, but of course, we have to keep following the data, following the science. In terms of whether vaccines might have to be modified with new variants, that's possible. That's what happens with the flu. So the influenza vaccine each year has different strains of the virus contained within. And that's why you see fluctuations in incidence prevalence of influenza every year. You can have sometimes very bad flu seasons, sometimes less bad flu seasons, because it depends on the potency of the strains that are circulating and how effective the vaccine is against those strains. So you always, with influenza, have to be very cautious in terms of your assessment. You can't just have a look at one season, you have to look at it over what we call a range to really understand how that infectious disease is changing, mutating, and therefore what is the impact of the vaccine as a consequence of that.
Go on then, yes.
Sorry, just follow on for that. So is there any available data or research about the people who recovered from COVID as to the length of their immunity that they have once they've recovered from COVID? Is there any data about that?
There's some provisional data on what we call like antibody levels within the immune system. The evidence there is still not clear to what extent is someone effectively triggering an immune response having recovered from the disease. And I think that the bigger concern at the moment scientifically is to the extent to which, even if someone did have some kind of legacy natural immunity from recovery, to what extent would that last? Because if your body has been subjected to such severe disease, and thankfully you've been able to survive, that could be associated with complications, and there is the potential that the immune system may have been scarred. So again, in those situations, the advice would still be, after a period of recovery, based on consultation with your doctor, HCP, because obviously in those instances, sadly, that person would have been very ill, so might then have complications, if deemed appropriate, to still get the vaccine. But the evidence there is still emerging.
Okay, thanks, Stuart. Somebody else spoke just before or just after Councillor Brother Ilyas. Was there any other people with any other questions at all?
Assalamu alaikum, Sajid. Yeah, it was myself. It's Haroon. Stuart, the question I have is ever more clear in the recent figures that the BAM community is heavily affected, and the mortality rate is very high within the BAM community, and obviously encompassing Asians. Could you explain a bit more to everyone if there's a link to obviously the BAM community being more likely to get coronavirus than the wider public? I know there's obviously the understanding there's quite a number of BAM community on the front line working in hospitals, and obviously in our community there's a lot of people who are also working in public facing roles and or engagement of general public, be it shop or various other types of businesses.
Yeah, thank you very much, Harry, for the question. I mean, you're right. The evidence so far would tend to suggest, just on what we call in epidemiology incidence prevalence, what that means is number of new cases and how much of a disease there is within a population or a cohort. But that community you describe has been disproportionately impacted. At this point, it's difficult to know fully why, because the microbiology and what we call the etiology, the sort of underlying causes of the disease, are still being understood. We've got to remember this is still a very new infectious disease, so we are constantly learning about it. But I think what it does speak to, and the point that you're highlighting, is that based on the evidence we have, people from that community are disproportionately at higher risk. So that does mean, and I would like to think it reinforces the importance of the current guidance, particularly around social distancing and washing hands and wearing a mask, but also the importance of people in that community getting vaccinated, because the evidence is suggesting, and we don't fully understand why at the moment, but people are at a higher level of risk. So whenever you're at a higher level of risk of anything, the need to protect yourself becomes even greater. So I think that is a really important point you're raising there, and it's a really important reason why I would encourage people to get vaccinated. And I know just in the chat, it's a really good question that was asked about what is herd immunity, and it's been well answered there, so I won't repeat the answer. But another one of these odd phrases you hear, herd immunity, it's like strange sort of phraseology. But the other reason, is that herd immunity, because as we talked about just a few moments ago, the evidence is now suggesting that these vaccines could prevent onward transmission. So what that means is, let's take an example. If that is true, let's say Mohammed, Sajid and myself are in a room, and let's just say, for argument's sake, we never leave that room for the rest of our life. I know that would be terrible for Mohammed and Sajid, but bear with me for a moment. But let's say, for example, Mohammed and Sajid got vaccinated and I didn't. I didn't get vaccinated. In that situation, assuming, of course, the vaccines were 100% effective, Mohammed and Sajid could protect me from the virus, because they would provide a herd immunity to me, a protection to me, because they can't spread it to me, they can't give it to me. So if I went to shake their hand, or they went to pat me on the back or hand me a drink, it would be okay, it would be safe, because in that instance, they're protected, so they can't pass it to me. Now, of course, the best thing to do in that situation absolutely would be for me to get vaccinated as well, and then we're all directly protected. But that's why vaccines also are magic in many ways, because they can not just protect yourself, but help protect others. And yes, we've got to see the evidence come forward on these COVID vaccines, but really good news from the AZ Oxford recent study that it would appear that onward transmission is being stopped, curtailed. So that's another reason why, from a community point of view, not just an individual point of view, getting vaccinated is important.
Sure. Thanks, Stuart. So there was another question in the chat talking about flu and the death rate from flu and the death rate from COVID. Are you able to touch on that further?
I am. I'm just having a look at it. So I see a couple of
It's right at the top.
So I think, right. So yeah, so I think the point here is that so far the evidence is suggesting that influenza is significantly down in terms of its number of cases. That is the case. It would appear to be so. I mean, we've got to be a little bit cautious with that because the season in the UK, you know, we tend to judge it once it's run through to the end of March. So you have to look at a sort of whole influenza season. But what would appear to be the case is that the strains that have been circulating for influenza this year have been less potent, less severe than in previous years, which is, you know, lucky and fortunate, because of course the last thing we would have wanted is a very severe influenza circulating as well. In terms of the death rates on influenza, they do as a consequence of that look like they're down. But also one of the other things that has happened this year and in previous years, we have now got more effective flu vaccinations. So we've had flu vaccines in the past have tended to be what we call egg-based flu vaccines. We now have recombinant and cell-based vaccines, which are a lot more effective. So of course, when people are getting vaccinated, you would expect less cases to result. Also, if you take the UK as an example, this year we also extended the vaccination programme. So previously the vaccination programme was offered to people over 65 and anybody with an underlying health condition, and then school children receive a nasal flu vaccine. This year we actually extended the programme to over 50. So anybody over the age of 50 could get a flu vaccination. And the uptake rates have been extremely high, much higher than previous years. So of course, as you see more people being vaccinated, you would expect less spread of the virus, and that should also then positively reduce the number of cases. So there are some of the reasons. I mean, at this point, it's difficult to give a full conclusion on influenza because we haven't got all of the data in, and it does need to be analysed at a country level, and then of course at an international level as well.
Sure, thanks, Stuart.
Thank you, Stuart. Sajid, if you don't mind, can I just chip in one thing?
Please,
I think it was Harun who asked a question about the evidence and stuff. I've just put a link. It's quite interesting read, because after considering all the other factors, there was a disproportionate death rate between BAME community and non-BAME cohort. So this is a public report. Anybody can have a look at it. And I think what might also be helpful for our community, that most of the time we don't understand the clinical jargons. We don't understand the scientific explanation of the things. So it might be worth kind of looking from that angle, that for a layman or a lay person, what would work better, because a lot of time when the new vaccinations are infectious disease, all that has been discussed, it's been kind of like explained in quite a very strong scientific language, and people struggle to understand, and people struggle to relate that. That was the feedback I was getting from a couple of people, that sometimes they simply don't understand, and it's not been explained properly, sort of thing. So Stuart, you've been brilliant explaining some of the things with your everyday examples. So but it might be worth, especially people, Sajid, I'm thinking those don't speak English, what would the best way to kind of communicate this very crucial, important information to them? Should there be like more videos done like they've done in Birmingham and Midlands, in Urdu, in Punjabi languages, to explain the whole process? Because I'm just thinking, looking at the cultural dynamics of our family structures and stuff. And please don't shoot me if I'm just making an assumption. I think if my granddad doesn't listen to me, there's no way I can force him to do something until he wants to do, sort of thing. It's that sort of hierarchy in our family system, is that no matter how many times young members try to convince them, you've got to get our elders on board, sort of thing, to make sure that things turn into an action. And maybe it might be good kind of, we have like some sort of like a focus group, and I was saying, I know you've sent an invite to everybody, so maybe with women as well, just so they can openly ask questions of their concerns and stuff. And we have bilingual speaker, all of you guys are here, sort of thing, to kind of help process that conversation, because like you said, COVID has impacted each and every one of us. None of us, in this even, setting that can say, actually, I don't know anybody who didn't get impacted. I know a lot of people that were very close to, our friends and family circle, and unfortunately they lost their life, colleagues who lost their life, people, those who are working with us a day before, and suddenly, a week after being on a ventilator, they've lost their life, and they're young, 40, 45. It's not that, it's impacting everybody and any age cohort sort of thing. So the threat is very real. So in terms of our understanding, and I can see the figures that the infection rate for Maidenhead is less, getting lesser in terms of the other areas. So which means people are adhering to, and to be honest with you, being a resident of the community, I think we are following the guidelines very well, in terms of the social distancing and stuff, whether it's a town, whether it's in our mosque or temples or gurdwaras, everybody's been quite, stringent in terms of, their support to each other. But I also think sometimes it's very important to see the harsh reality of the impact of this killer disease has. So, families, those have suffered more than anybody. They are the best people who kind of, inform other people. And the information I was getting earlier was that in the beginning, as part of our culture, it's very difficult, if somebody died in someone's family, it's very difficult if somebody turns up on your door for condolences to say no. How do we say no, kind of thing, but we've got to say no to them to protect ourselves and protect them. And I think the health system and all the local authorities and the public health, they're also understanding the cultural impact of our behaviors towards different, events, whether it's, funerals, whether it's just supporting somebody, because we go into a mode of supporting each other. We without realizing, we just rush to go to see that family to make sure that they're okay, to offer our help and offer our support. And I think in the beginning that contributed also, because people just turned up on people's homes and people couldn't say no to them, sort of thing. And it's completely different because, in our mosque, we get a regular message from you guys that, the family wants all the condolences via telephone and stuff. So that really worked very well. So, I really wanted to, give my really positive feedback. As a resident of Maidenhead, I feel really privileged and proud that, the mosque is doing so much work to support the community regularly and vigorously. You guys have been sending messages, communication, and I know I worked in the local authority in RBWM and with the public health. I know people listen to faith leaders, people listen to community leaders because you're part of us, sort of thing. And they're seen as independent, not as part of the system, because there could be a lot of issue going in the background. So I think a forum like this is very, very helpful, but I would really, really also stress that maybe we gather feedback, or you gather feedback with the community, and we get a panel of clinicians, answering direct question, with everybody. And then people probably will have more, like me and you and Stuart, we can help as much as we can. But, if my doctor tells me quit smoking, I'm going to listen to him. If my brother tells me, I'm not going to listen to him. It's that sort of behavior where the information is coming. My doctor is telling me, you're going to die. You've got to quit this. And, as a family member, I might not listen. So it's human psychology. We listen to the credible source, sort of thing. So I know they're doing today a live session with the mosque and a couple of GPs in Slough today as well in the evening. Yeah, so it might be worth checking that at this side as well, kind of to make sure that we get people on board, because it's very important that we all nervous, we all stressed, we haven't seen our family members, we all been inside, and mental health is just completely hitting a different parameter as it was 2 years ago, sort of thing. People are stressed and they're vulnerable, they don't know. And I was talking to somebody earlier and I'm saying for our elderly, mosque is the social hub for them. They have no friends, they have no restaurants or pubs to go to get together. Mosque is for them a social lifeline where they go and they see each other and they talk about their families and everything. And suddenly, because of the restriction, that's been taken away from that group also, and there's no support. If you look at it, we all confined in our homes and stuff. And for our elder groups, and even for younger groups, that was the activity that every day go to mosque, have a chat with your friends, have a chat with mosque people, with imam. It kind of became like a counseling hub as well, isn't it, for that cohort? So it is very challenging in current guidelines in terms of restriction and stuff. So I think event like this, if more people can join in future, would be really, really beneficial, because what you guys are doing is trying to provide that portal through technology rather than actually opening the mosque door. So, well done to all of you, and thank you for Gurpreet and Stuart for making sure that this happens and people get the right information. I really appreciate it.
Yeah.
Sorry, could I interject there, Simran? I understand what you say. I believe the community as a whole, as Sajid said, there's been a huge number of deaths, and Sajid was saying it's a weekly occurrence where he goes to the graveyard to bury one of our brothers and sisters. I think the wider community, there's a number of doctors within the Muslim community here. I think people are aware of the dangers of COVID. I know there's speculations of obviously vaccine, and there's a comment which is in the chat, and it's particularly individuals like that, like Ann Sabir, who mentions that vaccine does not give you immunity, and it was those kind of individuals why this conversation is happening, is to tell people that taking a vaccine is the only measure that you're going to have in or giving you some protection in not catching COVID, and that itself resulting in deaths, be it the person who catches it themselves or people around them. I think that the level of that's the very individuals this Zoom call is targeting at, and I believe there's loads of other information which is circulated by a number of other community WhatsApp groups and other means of social platforms that are doing this. So the big thing for me, Stuart, with obviously coming on here and mentioning that, is that conversation that we have in chat, could you just broaden that up? I mean, it's ridiculous what that individual was saying. It doesn't make no sense, and the fact that there's studies and over 2 million people dead, and there is obviously facts and information. A lot of money is being spent on this vaccine. Could you explain to Sabir that this isn't a joke and it's a very serious fact?
Just to come in this quickly, Sister Marina has made a lot of good points there. There's been a lot of feedback around how the community has changed. To be honest, the world has really changed around this. And as you talked about, our elders were coming to the mosque 5 times a day, and they're currently not allowed to do that. Families have adapted, in the community, because this is quite a tight-knit community. So parents have been calling their children up, and vice versa itself. And there's been a lot of interaction socially. I know there's been families doing Zoom calls in the evenings, so the whole family can join together and have a discussion. There's been a lot of that, and there are community people who don't have many people to support them, but alhamdulillah, generally, the world, the community around us has been supportive, and the mosque has remained open only because people realized that the importance of following rules and regulations. I know we had to remind people, as with most people, and the brother who's made the earlier comments as well, to be honest, they're useful comments. So that's the way I see it, because there are people out there who ask those kind of questions and make those kind of comments. So in a forum like this, if somebody suggests things like that, it's useful and it's healthy that we have those discussions, and they've come to the forum, out in the forum. Stuart's been able to tackle those questions directly, and the wider people who will listen to them have had the answers to those as well. So, I'm not pointing fingers to anybody at all itself. I think every question is positive because it will help somebody out there itself. But I mean, the world has changed in quite a big way over this year. I'm hoping things will get better over the next couple of months as things come under control. But yeah, obviously there are options available. The vaccinations options are available to people. People know the value, the benefit of having those. And also understand that there's a lot of testing which has gone into those. There are some questions, like for example, we talked about fertility, which maybe there is more research going on at the moment itself. So it's an ongoing thing, and there's different strands coming along as well. There's a lot of things going on. It's a big ocean of things there, and there's a lot to take in. So people will rightly sort of understand the situation and make the best decisions. And obviously, Stuart and the team here have come on, and yourself, Samrin, give us really, really good information. We've had some excellent questions come out from Brother Mohammed, the emails which have come in, Brother Haroon, Brother Nadeem. They've made some very, very valid points, to be honest, this evening, and I've certainly found it very valuable that I've taken out an hour or so this evening, and I've had the luxury of having somebody as qualified as Stuart on the call to answer those questions. So really, really appreciate, Stuart, you making your time and set up the.
And I think if I can just quickly say, Sajid, I really appreciate it. And look, I think it's right. If anybody's got concerns, questions, points of view, it's important that those are discussed, and it's important to have that debate. And I'm very happy to have that debate and have that discussion. I think just quickly worth saying, just to be very, very clear, that in the case of influenza, we must separate influenza from flu, or what we call common cold. Influenza is a actual very serious infectious disease virus. I note some of the comments about nutrition and wider consideration. Absolutely, that's important. We've got to all keep looking at our wider health, and someone who's the lead member for mental health takes an active personal interest in that. I think, of course, we've got to support one another. We've got to keep being there for one another. All of these things are absolutely imperative. But I can just say, on the comment that's been put in about Professor Jonathan Van Tam, I know him personally. He's actually my mentor. So, he hasn't said that the Pfizer vaccine does not give you immunity. That he's not said that. What the quote is saying here is he's talking about the level of protection you will get from the first dose to the second dose, and how that then moves through in terms of a immune response to the system. But look, all questions are good. We've got to have this discussion. We've got to be open. We've got to have that debate, and it's very, very important that people do feel they can come forward and have those discussions, because in the end, what is vital is people get the right information. People make the best decision. And my unequivocal message to people are that people get vaccinated, protect yourself, protect other people. That's the only way we're going to get through this pandemic and out of this pandemic. But look, I want to say a massive thanks to the mosque. I know you do tremendous work in our community. I'd like to echo many of the things that were just said earlier, in terms of all the things you're doing. Not just in the Islamic community, I know in the wider community, and I really, really appreciate it, and really grateful to you, Sajid, for inviting me on to have this discussion. And absolutely, I'm happy to come back for future discussions, and anybody can contact me anytime. It's not a problem, and I really, really appreciate everybody attending. It's fantastic to see this level of enthusiasm, and this level of interest. I think that is a wonderful thing to see.
Brilliant. Super. Yeah, thank you very much, sir. I've got a bit of an echo now. Yeah, Gruppy and everybody, all the people who've joined the call today, all the people who've sent the emails in, asking the questions, a big, huge thank you to everybody. And that's from the bottom of my heart. We're in it together, and we're going to come out of it together as well. And it's only going to happen with the support of each other and working with the likes of people like Stuart and the community. And that's what it's about, really. Is sharing and caring for each other and being there for one another. And that's what makes us, good people, at the end of the day.
Absolutely, echo that. Thank you so much. Yeah. Thank you, everyone. Thank you.
And thank you for your time.
Stay safe, stay well. See you. Bye-bye.
Good night. Thank you. Bye-bye. Thank you.